Cerebral palsy. So cerebral means brain and palsy means pausing. This is a condition caused due to congenital problem. So it is a condition of impaired movement and posture, resulting in abnormality in the extrapyramidal or pyramidal motor system. So what happens in this condition? It is a permanent disorder where of movement it is present with stiff muscle tone. The muscles are very stiff and tremors and involuntary motions happening. The client will have abnormal posture and lack of physical coordination as muscle spasm come and go at any time. This happens because of the abnormal brain stem development during before birth, which results in developmental delay, especially delay in walking, speaking, and swallowing. Those activities will be delayed because this needs major muscles control. So patient will have a multiple symptoms. So causes of this is prenatal hypoxia, for example, radiation therapy, infection during prenatal period to the mother or the baby, postnatal hypoxia due to head trauma, meningitis, and it happens because of brain causing paralysis, which leads to a variety of issues, depends on the which part is affected. And the cerebellum damage occurs, fine motor skills like writing and those skills will be affected. So symptoms will be poor head control, the head will be lagging even the baby is over 6 months, muscles will be so rigid and spasm there, Lewinsky reflex is positive, and extreme irritability and crying and feeding difficulties because they have poor swallowing reflex, and all the milestones will be delayed, and arms will be so stiff, and legs will be stiff, abnormal motor uh, movement. It's a progressive condition. It is not a progressive condition, it stays as it, but it leads to developmental delay, right? So infant will not achieve their primitive infantile reflexes like motor reflex, and those reflexes will be, and in severe cases the child can have seizure as well if it's not untreatable. It is not curable, it's only treatable disease, and treatment will be based on the whatever the symptoms are present. So we have three types of cerebral palsy: spastic, stiff muscles, and then dyskinetic, abnormal movements, taxic, which affects the balance and coordination, and mix, in which we have all three types or mixed type of symptoms present. So muscle relaxants are given to help manage the spasticity, that is baclofen, botulinum toxin. But long-term therapy will include physical therapy to strengthen the muscles, occupational therapy to help manage the daily living skills, then speech therapy and assistive device like braces, walkers, wheelchair, and surgical approach will be used to deal with the physical uh, disability problems if they have, like any physical problem. So this will be done for that. So just you have to make sure you are providing them safe environment, like removing the sharp objects because they are at high risk of fall, prevent giving them like a helmet, and using the seizure precautions, and airway is the priority in this case too when you're feeding, so upright position should be given, and safe toys according to their developmental stage, not according to their age, because if they are 6 year of old but they are not able to do the activity what they're supposed to do, so you're not able to to give them the toy according to their age. It should be according to their developmental